As a quick reminder, tomorrow's press conference will be at 2:30 instead of 1 o'clock, and then we'll be back the next day and every day at 1 o'clock. So we'll begin, as we always do, with a quick look at the data. This data should be on your screen. And it's a good news story. Again, we're starting to see a decline in the number of cases. Today, we're reporting 134 new cases. Very sadly, 26 additional deaths. So again, I would ask everybody in Rhode Island to bear in mind those who have lost loved ones during this incredibly difficult time. I want to just continue to ask everybody to keep following the rules. So I know it's not easy. Keep wearing your masks, washing your hands, getting tested if you're sick. Above all, stay home if you're sick. Really, stay home if you're sick. This is not just about keeping you safe. You know, I've heard some people say, well, I'll just take the risk. It's not just about you, it's about everyone else. It's about you spreading your germs and getting other people sick. And so I'm just asking you, this is life now, this is our life. I can't change the virus, we can't change the virus. We can learn how to live with it though. And so just don't fight it, live within the new rules, and we're gonna be able to keep going back to life, out to dinner, going back to work, and doing what we want to do safely as long as we keep following the rules. Okay, so today I have an announcement that I'm actually very excited about because we've been working on it for a long time, and it's going to be a tool that really helps Rhode Island. We are rolling out today, a new phone app that'll help us deal with the coronavirus. The app is called Crush COVID. So it's Crush COVID RI. I love the title because we are crushing COVID. And it's a one-stop app that is going to help us do symptom monitoring and test ordering, get your information, and do contact tracing. It's now available for free download at the Apple App Store and Google Play in both English and Spanish. So take a half a second, takes 5 seconds. I did this yesterday. It'll take you 5 seconds. Go to the App Store, Google Play, Crush COVID RI, download the app on your phone. We are the first state, or one of a few first states in the country, to roll out a one-stop app of this kind. And I'm going to take a couple minutes now to review for you exactly what the app does and why I'm so excited about it. You know, I've been saying that, people keep saying, when can we go get our hair cut? When can we go back to church? When can we do this? Some of it has to do with our cases. A lot of it has to do with our systems, our getting ourselves ready. And this app is going to be very helpful. Before I explain what it is, I have to say thank you to so many people. The first thank you goes to BJ Kumar and Chirag Patel, who work for the state. These guys have worked with their teams truly 7 days a week, around the clock, to produce this app. So to Chirag and BJ and your teams, thank you. This is a homegrown app. We have worked and collaborate, our own team at the state, in collaboration with a local company, Infosys. We brought Infosys to Rhode Island a year or two ago, and they have an operation here. Ravi Kumar is his senior person there. I reached out to him, I said, help us out, and they have, for free, been working around the clock with us to develop this Crush COVID app. So this is a public-private partnership, and it's going to be a tool that'll help everybody in Rhode Island get through the crisis. So what's it going to do for you? The first thing is, it talks about, it tells you where to get resources. So as we go through the crisis, different people will need different resources at different times. If you need food delivery, you can figure out how to get that done on this app. If you're a healthcare worker and you don't feel that it's safe to live in your house, you need to find a free place to live, you can find that on the app. If you have tested positive and you don't have anywhere to isolate safely, you can find that here on this app. So just, it's a constant at your fingertips place to go get resources and figure out the resources we have available. If you're elderly, if you're a veteran, if you're a healthcare worker, it's all here for you to access. It also provides information. So I have said from day one, knowledge is power. Keep yourselves informed. And it changes. Every day there's new information. We learn more about the virus. We learn more about our ability to adapt to it. So you want to have that information constantly updated at your fingertips, so all of that information is in one place on this app. This press conference, for example, will be streamed there on the app. We're putting news updates. The Department of Health will put updates there. So I would really encourage you to stay up to date so you can keep you and your family safe. Testing. So because of a lot of hard work, Rhode Island is #1 in America for our testing. More tests than per capita than any state in America. At this point, we've tested almost 12% of our population. So we want to stay ahead of the curve with testing. How do we do that? We got to have folks have access to testing. You can go on this app and you can schedule a test. You can figure out where you can get a test and you can schedule a test. You can, and there'll be a number of ways to do that, through your primary care physician, at the CVS site in Twin River, one of the walk-up sites. And this is really important. As the months go on, we're going to change the way we do testing, because we want it over time to be all driven through our healthcare system. Ideally, everyone who wants to get tested or needs to get tested should have a connection to a healthcare provider. So this app will be constantly updated, so you can find out where to get a test, how to get a test, and order your tests. Symptom tracking. It is critical. If we're going to stay ahead of the virus, we need to know about outbreaks, before they happen. So the app will prompt you, I think, once a day to take a 10-second survey. How are you feeling today? What are your symptoms? Do you have a fever? If everybody does that, we over time are going to get a good view across the state of, are there schools or neighborhoods or regions or buildings where we see problems in symptoms, and that will enable us to react quickly to those issues. I took the survey yesterday. It takes a few seconds, and you do it every day. And then the key thing is what we're calling the location diary, and that's what is in this app. So for a month and a half, I've been up here every day asking you to keep your contact tracing notebook. I've asked you in that notebook to write down where you've been and with whom you've come in contact. That can be hard to do. Sometimes you forget. You forget to do it at the end of a day. You forget where you've been. So this will make that easier. On the Crush COVID app, there is a location diary feature. It's called My Location Diary feature. Here's how it works. When you open the app, it'll ask you, do you want to enable the My Location Diary feature? It's your choice to say yes or no. If you say yes, the app will create a map of places you visit in a day where you've been for 10 minutes or more. So it's kind of like a Google map. If you are in any location for 10 minutes or more, it'll show up automatically logged on your app. So at the end of the day, at the end of any day, or any 3 days, or any 5 days, you can pull up your own location diary, and it'll have a list of all the addresses where you were for more than 10 minutes in that period of time. If you do choose to enable the location diary, the data around where you've been is stored on your phone only. That's really important. It's only on your phone, and it's only if you enable it. And it is automatically deleted after 20 days. not stored in a database. Infosys, the company, has no access to it. Apple has no access to it. No company has access to it. It's just literally on your phone, automatically deleted within 20 days. Available only to you. Now, if you get sick, you get the coronavirus, you'll get a call from the Department of Health, and the contact tracer will ask you, would you share your location diary? So then that's another point at which you decide. You could say, no, I won't share it, but you could read what's in your phone to the person at the Department of Health. Or you could say, yes, I will share it, and it will be shared. At that point, your location data will be shared with the Department of Health without your name. It'll have an ID number, not your name. If you give permission, the data will go to the Department of Health, never to a company, never to any other state or federal agency, only at the Department of Health, without your name. And that information will be used for the exclusive purpose of doing contact tracing in COVID-19. Why am I saying all that? Because when I started this, I said to the team, I need you to make something that tracks contacts and enables us to keep a lid on the virus, but protects people's privacy and data in an ironclad way. And so that's what this is designed to do. Furthermore, this is completely your choice. No one is ever going to make you download this app. No one is going to make you turn on the diary feature. No one is ever going to make you share the data. I, however, am asking you to do this. I've done it. I'm urging my friends and family to do it. I'm urging the folks who work for me to do it. And I'm asking you to please download the app and enable the location diary feature. Why am I doing that? Because these systems only work insofar as everybody uses them. It's true, we all have our own privacy rights, we all have our own rights to live freely, except in this virus, we're all very connected. My desire and ability to breathe freely without a mask endangers you. And the same is true for this contact tracing app. It only works if everybody's using it, so that we can see where everybody is, because the name of the game is containing the virus. We can't stop it. We can only hope to contain it. And so if everyone's on it, we can quickly identify hotspots, get everybody tested, and everybody into isolation. I'm sure there'll be a lot of questions about it. I'm sure some people will feel uneasy about it. I'm happy to answer any questions. But if this works as intended, which is to say the majority of Rhode Islanders check their Crush COVID app every day, track their symptoms, order a test as soon as they need it, enable their location so that our contact tracing can be very effective, then I have a great deal of confidence that when we start going back to church and start going to the beach and start going to get our hair cut and start going out to dinner again, we can keep a lid on the spread of the virus, and also, if there are outbreaks, react quickly. I want to say this. We're not a software development company, and I don't want to pretend that we are, so please don't expect the same level of slick functionality that you would for an app that you're going to get from the App Store. This is just a tool. This is a tool. It's meant to do its job and be, functional. Also, what we're rolling out today is not a final product. It's version 1. So I'm letting it out into the open. There will probably be glitches. You probably won't like certain features of it. Give it a try. Be patient. We're going to roll out another app in probably a month, another version in probably a month with some more functionality. But also give us your feedback. So we want to incorporate your feedback into version 2 of the product. And you can do that by visiting health.ri.gov/crushcovid. And if you have comments on how we can make it better, then send us your advice. My hope is that together, we, the people of Rhode Island, will, in fact, crush COVID. Okay, one last announcement, also a good news announcement. I'm moving us towards reopening childcare centers on June 1st. That's a week from Monday. We have a lot of work to do, but we're on path. So the plan is as intended to start reopening childcare June 1st. I have been in touch with a lot of businesses who say it's impractical to reopen business if there's no childcare. So we're trying to respond to that need. As we reopen, asking for a little bit of patience. It's going to be different, but we're well on our way to enabling it. We have more than 900 child care settings in the state of Rhode Island. Every single one matters. Every child in every one of those facilities matters. And so we're trying to give them a hand. We're working hand in glove with them to give them guidelines, technical assistance, et cetera. But today I'm announcing that will be supporting child care centers with 50,000 surgical masks. It's just a way to help them get started, to give them 50,000 surgical masks to keep them safe and the kids safe, and give parents a sense of peace and comfort and confidence that it is going to be safe to return your kids to child care. I want to thank the SEIU 1199 and the Rhode Island Association for the Education of Young Children. They're going to be working with us in the coming days and weeks to distribute the masks, the 50,000 masks, to the 900 child care centers in the state, and from home daycares as well. So we have home child care providers and the big facilities. Everyone's going to get a mask, and we are going to do our best to make sure that everyone can open safely on June 1st.